Dale Lincoln, and this is my son Daniel. And we came here to visit Dr. Sims. Because at age 5, Daniel's 10 now, but at age 5, he started exhibiting signs of rapid blinking. And at the time, we didn't think anything of it. We were told that he would outgrow that. They just kind of discovering their blink, and just that's what it was. Well, it wasn't too long after, and it was replaced with a shoulder shrug. And again, we didn't think too much of it. It was annoying, and the teachers didn't say anything in kindergarten, so again, we just figured it was a nervous habit that he would outgrow. Probably about age 8 or 9, a few other things were starting to exhibit a spitting that he didn't want to swallow, and I learned later it's kind of a gag reflex, and he said it felt like he had a lump in his throat, and instead of swallowing, he would inadvertently, try to hide it as best he could, but he would, spit into his hand and put it in his pocket, and that the teacher did notice. And so then we knew we had something more than just nervous habits, so we started looking on the internet for what was going on, and we really couldn't find anything, and took him to a naturopath. He thought it was maybe mercury poisoning type thing, so he went through and had a couple DMPS chelations done, and that didn't help. He experimented with his diet as far as leaving casein and gluten out of his diet, and it would be hit or miss. We'd think we'd have something, and we'd go for a couple of months without dairy products, and then it would start in again. So we just couldn't find a pattern to what was going on. And then when he was 10, his tics became worse, where it's almost his whole body was involved, from the shoulder shrug to the blinking to the abdominal to even his left leg dragging a little bit, to where he would almost have to bend over when he was having one of these, almost a seizure type thing. And then it was accompanied with more OCD, spending time washing hands, and tapping on the floor, just very, where you couldn't rationalize with them that it wasn't necessary to do that, and it was very painful to watch and very time consuming. So a couple weeks ago I went one more time on the website and put in his symptoms, and I was brought to a Tourette's, which we had never had. We never went to a doctor that diagnosed him with that, but we suspected. And on the website it mentioned Dr. Sims' name, and it wouldn't be medication. And so I followed through and made a phone call, and here we are, getting ready to put that apparatus in his mouth, and praying to God, because it does, it affects your whole family. It affects, you never know when you take him somewhere. It's not the tics, the movement you can handle, it's the OCD that accompanies it, she takes it out on his sisters and the behaviors that would be such a relief to alleviate this. That's why we're here. That's what I have to say.
Okay, big guy, you talk a little bit.
Hi, I'm Daniel. I'm 10 years old. That's all.
That's it?
Yes.
All right. Whatever you notice, any difference? Any different things have you?
I don't do shoulder shrugging anymore.
Okay. All right, I'll tell you what I'm going to do. I'm going to just do our little test, okay? Just to see if your blinking stops a little bit. How's that? All right? All right, hold on a second.
Your tongue will get used to it, Daniel.
Yeah. We cut the back ones off so that the second molars, the very last molars, can erupt properly. Okay, so we want those to erupt even further than where the other ones are, because where they are right now, that's the pathology. Okay,
I understand.
so we raise it up to where it's non-pathological,
Yeah.
pathological, and that's where he is right now.
Symptomatic.
And matter of fact, if you what I'm actually looking at is it's brighter, wider.
You know, I can show you his last class picture. Yeah, the dullness,
Mm-hmm.
the flat kind of, absolutely.
Feels strange, doesn't it?
It's okay. I
But
went
it's
through
okay.
the same thing, and it's just a step, a needed step, because you're not doing those spasms, those
At
movements.
least it doesn't hurt my teeth like the other one did.
Yeah, I bought it over the counter.
Oh,
just
okay.
to see.
Yeah.
And you're right, this is much more comfortable. This is tailor-made, which is why you do not take it out, because you do not want to lose it. And the more you keep it in, the faster we get to that second step and third step.
Do I sleep with it then?
Yes, you do.
How about breathing
You know
with
what?
it?
I bet you're breathing better. I bet you won't make those noises when you sleep.
Should I jump with it then?
You do.
Yes, you can. You can jump with it. You can play with it, all kind of stuff.
Swimming?
Swimming. It won't. If you're comfortable with it swimming, fine. But if not, then,
Okay.
yeah,
It does it a loss.
Yeah, it can get a little,
It'll float out, maybe.
Yeah,
Yeah,
it'll be
I think we'll take it out for swimming, just for now.
yeah.
Yeah.
All right, I tell you what, take it out right now. Let's see what you got. Can you pop it out? Good job. All right, just hold on to it for a second. All right, pop it back in.
Yeah, it fires off right away.
Uh-huh.
Now, I'm sure it doesn't, but I'm just this doesn't suppress them.
No.
I know it doesn't.
No, it's not. It's not a suppression.
Yeah,
It's a elimination.
Absolutely.
Okay. It's an
It's just
elimination.
amazing how, because I know you'd store them up from school, and you get home,
And then-
that'd be like the worst.
Well, this is
Because
what it
you
can.
get so irritated.
Mm-hmm. I
Should I talk to Jacqueline on the phone and see
Yeah.
if she notices?
She won't notice, and in some ways, it's probably going to be easier to understand because your mouth is open better.
Mom, could I talk to Jacqueline now and see if she notices that I have something in my mouth?
Let's wait till we leave here.
Okay.
She'll do that. Has to be taken out to be cleaned.
Yes. When you take it out to clean it, right? Pull it out. Keep your mouth open.
Okay.
Keep it open. Brush teeth, tongue, gums, everything that you normally brush. Brush the appliance, but without closing. Okay? After your appliance, take it back in, then you close.
Hear that, Danielle?
What if slobber?
You'll slobber a lot. That's that's how we make money on everybody. We take pictures of when they slobber, and then we tell everybody, if you don't do what I tell you, I'm going to put this up on at school.
Just think you don't have to worry about doing spasm around people in school. You'll be able to really concentrate.
Yeah, pop it out. Let me see.
Really nice.
Let's just see how you do. Hey, you're good at it. Instant change.
I should have brought my video camera.
Well,
Well, I can do it at home.
you can do it at home. You got it. You can do it.
And as that over time.
I don't want you to hit your hands on those things.